Indigenous communities have always been data keepers, using knowledge passed through generations to protect the land, water, and health of their people. In today's digital world, there is a need for tools that allow Indigenous communities to manage, store, and protect their data while ensuring privacy, security, and accessibility. This is where digital research infrastructure comes in.
The DRI stands for Digital Research Infrastructure. It is a strategic investment from Canadian government. In the 2018 budget bill, they committed $570 million plus to establish this infrastructure. The goal is to place Canada in the leading edge, allowing Canadian researchers, institutions, and Canadian public be able to develop a research. The digital technology, the ARC, it's advanced research computing. That is where the large computing powers and the GPUs and the CPUs, the infrastructure we need to develop the AI and those algorithms, the solutions. This infrastructure is hosted a number of very large data centers across the country, and Waterloo happened to have one of them, and they are called the Graham Center.
Having a set of digital resources and services that support the secure storage, processing, and analysis of data with key components including supercomputers that analyze large data sets at high speeds. The ability to secure digital storage, archiving, and governance tools, and have research software tools for data visualization, analysis, and AI-driven research is very powerful. And for First Nations, DRI is more than just technology. It is a means to assert sovereignty over their data. The First Nations principles of OCAP, ownership, control, access, and possession, is a registered trademark of the First Nations Information Governance Center, FNIGC. It establishes guidelines for how First Nations data should be collected, protected, used, and shared. These principles ensure that data governance being developed aligns and is implemented with community values and priorities. Vision is essential to independence, quality of life, and daily activities. Optometrists across Canada see patients throughout their lives, and that data can be a powerful resource to help unlock biomarkers as predictors for a wide range of diseases. This is why vision care is an increasingly important health priority for people across Canada. Vision health outcomes are impacted by systemic barriers, including geography, socioeconomic conditions, and unequal access to care, particularly in underserved communities. Addressing these barriers can support equitable access to eye health services and reduce preventable vision loss.
CanView as an eye data repository will be able to allow us to actually aggregate information from all sorts of fragmented sources. So right now, optometrists have their practices in communities large and small throughout Canada. They have electronic medical records, they have diagnostic imaging data, but the challenge is it resides within their office. And so that then limits the potential to see how we can pull all of that information together to represent the diversity of the population in Canada, and ultimately to unlock the learnings and the lessons that we can get from big data.
The data lake concept is that the data from their practice can be submitted without too much burden from the clinical side point of view. And so you come in and we do data cleansing, we do data mapping, harmonization, and add inside the lake. So that's very important if they can use this platform to facilitate this kind of using the tool to achieve the goal for prevention, for monitoring, and also for early diagnosis.
AI tools could lead to earlier intervention and preservation of sight, better patient outcomes, and alleviate clinician burnout. We have the Graham Computer Center, we have a Waterloo.ai, which is a data science and artificial intelligence institute, we have a cybersecurity and privacy institute. We have a lot of the talent and researchers and graduate students and others who really are within this ecosystem, where if we can create this resource and repository for them, there's all sorts of different things that could be unlocked as we bring clinicians, patients, and those researchers all together to solve really complex problems.
By leveraging digital research infrastructure, CanView will provide insights that help optometrists improve patient outcomes and experiences. Researchers develop AI tools to predict ocular and systemic disease and personalized treatment. Policymakers develop improved service delivery and value to the system. And CanView's ability to analyze vision health data efficiently is made possible through DRI's advanced computing resource.
The importance of being able to have CanView as a beacon, if you will, to draw attention to the notion that eye health is important. It's a key part of our well-being, our quality of life, and it's important to be inclusive. And so being explicit and intentional, working with specifically the Southern Chiefs organization, they've been fantastic partners. They've been able to help co-design and work with us to develop ways in which we can better understand what the needs are of community.
Waterloo as Canada's leading computing education institution, plus now we have the computing center right on our campus, and which is very uniquely strategic for us to build the CanView on this kind of environment. So we will build CanView based on the DIR infrastructure, particularly the data could be hosted in the Grant Center in Waterloo, incorporating the OCAP principle into our design of our CanView architecture. There are ways as a technology side, and we are able to implement the different architecture, allowing them either physically host the data in their designated data center, or as they choose, they can actually send the data to a cloud computing infrastructure, but still exert the total control of who can access the data and how the data is shared for what purpose. So that's actually very, very important. That's why in the past year, we've been directly collaborating with them, with incorporating the OCAP principle into our design of our CanView architecture.
For generations, First Nations have held knowledge that guides our way of life, health, and governance. Today, our data, our stories, our health information must be protected by us. Data governance is about ensuring that all research and health data involving our people is controlled by us. Through the shared CanView project, we are putting into practice the principles of ownership, control, access, and possession to ensure that our nations decide how data is collected, stored, and used. When we govern our data, we protect our nations. We are working to ensure future generations benefit from the knowledge we build today without being taken, misused, or locked away from us. CanView is an opportunity to create a system where First Nations hold power over our health data and shape our own future. CanView is an opportunity to create a system where First Nations hold power over our health data and shape our future.
DRI Digital Research Infrastructure supports secure data infrastructure that enables First Nation to retain full control over their contribution data within CanView. The Southern Chief organization, plays a very key role in the governance rules for First Nation data contributed to CanView, ensuring that everything aligns with OCAP and fair and care principles. And CanView is continuously working to refine its governance model in collaboration with its partners.
The CanView data governance model is structured to ensure layers of control and decision-making that balances First Nation sovereignty with national research needs. So we have community-led governance, where First Nations define the rule for how their data is accessed and shared. We also have the Data Governance Council. This council can review and approve data sharing requests to ensure alignment with OCAP, fair and care principles. We also have layered access controls. This is where different stakeholders have tiered access based on their roles and data governance policies. For example, we have clinicians who may access de-identified patient data to improve the diagnostic and healthcare delivery. We may have researchers who may access aggregated non-identifiable data sets with explicit community approvals and under strict ethical guidelines. And we may even have policymakers receive their generalized high-level insights to inform health policies without any direct access to individual level data. CanView is Canada's first national vision health data repository that integrates First Nations data governance principle while also supporting DRI-backed AI research tools. So the governance model, developed in partnership with SCO, ensures that First Nations retain authority over their contributed healthcare data while participating in a national level research. So by embedding First Nations data governance principles, CanView demonstrates how national research infrastructure can also align with community-led governance models.
With a strong foundation established through DRI, CanView emerges as a practical application of this infrastructure and is revolutionizing vision care in Canada, demonstrating how vision health data can be ethically managed and utilized. By adhering to OCAP, FAIR, and CARE principles, and leveraging advanced computing and AI-driven research, CanView aims to improve vision health for all Canadians. For more information about how we're building a healthier future together, please contact CanView at uwaterloo.ca.